Welcome to Breaking Mental Matrices, the podcast where we challenge conventions, dismantle outdated paradigms, and tackle the issues that shape our world. I'm your host, Nicole Norman, and today we're diving deep into one of the most pressing concerns in our schools, mental health. In recent years, we've seen a stark rise in anxiety, depression, and behavior challenges among students. School psychologists are often the unsung heroes, fighting to provide support in an overburdened system. But what happens when there aren't enough mental health professionals to meet the needs of our students? What barriers present children, especially in marginalized communities, from receiving the care they deserve? And how can we as educators, parents, and policymakers do better? Joining us today is someone who has dedicated her career to answering these questions. Dr. Kristine Smalls, a clinical psychologist with extensive experience in school psychology, trauma-informed care, and advocating for the underserved communities. Dr. Smalls has worked in urban school districts, hospitals, and behavioral health centers, providing life-challenging interventions to children and adolescents. She's here to help us unpack the mental health crisis in schools and explore solutions that can lead to meaningful change. Dr. Smalls, welcome to Breaking Mental Matrices. It's truly an
Thank
honor
you
to
so
have
much.
you here.
Yes, thank you so much for having me.
Wonderful. Wonderful. So, Dr. Small, before we get into the larger systemic issues, can you give us an overview of what a school psychologist does on a daily basis? Because many people assume it's just testing for special education services, but I know it's much more than that.
Yeah, so I do believe that that's a big part of the job is the evaluation, so cognitive evaluations, for special education, having meetings, case managing, counseling, showing up for students who aren't even on your caseload, just kind of being a able person, a body for students to feel comfortable with speaking to and knowing that they can get the help that they need. I think that plays a large role in what school psychologists do to go above and beyond what their job titles define. Um, yeah.
Okay. Well, you've worked in Camden City schools, a district with significant socioeconomic challenges. Can you speak to the unique mental health struggles that students in underfunded urban districts face compared to those in more affluent areas?
So I believe that it looks different, just because of the different struggles. So poverty is something that comes up often when you think of, urban communities and underserved communities, violence, a lot of trauma, a lot of different mental health disorders kind of come about because of all the things that the children here in these communities witness. Um, Whereas though it doesn't happen as often in those suburban areas or the access, the resources that they have in the suburban areas that differ from the lack of resources that are in the urban areas. Um, I definitely think that resources, like I said, play a large role, and because there aren't many, they are left to their own devices to maintain their own mental health and figure out ways to kind of push through, as a lot of the students here do. And I think that social media has made it a big thing for mental health being acknowledged more with this generation where they are being semi-educated. I don't want to say fully educated because social media can open up a world of what mental health is and what it isn't. So it's not completely honest, but there are some aspects of it that is honest. So it kind of gives them the opportunity to identify when they are struggling and what they are struggling with. And then not having the resources to kind of figure out how to help themselves or get help, it kind of builds upon the stressors that, lead to more difficulties with mental health concerns.
So, well, now you did touch on social media, so I guess that's a good segue into the next question. because we seen alarming statistics about rising rates of anxiety and depression in children.
Mhm.
So in your professional experience, what do you think is a drive was driving this surge and students' mental health struggles?
So yeah, like you said, mentioning social media, I think that uh, uh, the awareness of other people talking about their own mental health struggles and children kind of looking at those videos, posts, whatever it may be on social media and, resonating with them and finding that, okay, there are other people that are struggling with some of these similarities, these similar things that I'm going through. And just kind of looking at it as, okay, maybe it is a mental health thing. I didn't think of it that way because I wasn't educated appropriately on what this could be. And here I just thought it was, okay, this is life. So seeing that other people are kind of going through the same things and putting a label to it helps them to identify that they are struggling with some mental health concerns. Where so if they didn't have the access to, the social media, they wouldn't have that education, or they may have the education or may not have had the education of it actually being a mental health concern.
Okay. So now, okay, now just to touch more into that. Now, what do you think as far as you know, I guess academic pressures, does that play an account, or even the post-pandemic anxiety, does those things play into account?
Yeah, definitely. So I believe that in urban communities, there are a lot of outside things happening in the kids' lives that aren't accounted for when you come into the school building. So having life outside and then coming into school and then having that added on stress, it kind of just overstimulates your nervous system and it causes a lot of a lot of stress. Just built on the things that are going on in life in general and not being able to have the appropriate coping skills to learn how to manage that stress outside and, managing the stress that comes with school as well. And I do think the pandemic led to a lot of this. Again, during the pandemic, you were at home. What were you using most likely? Your phone. And what were you using your phone for? TikTok, Instagram, YouTube, all these places where you have to look a certain way, be a certain way, you have to have these certain things. And if you don't, then you're outsider, you're outcast, you have all these different stressors coming from every direction.
Mm.
And, again, like I said, we had the TikTok educators that are talking about these mental health disorders and, making it a place where you can learn more about what it looks like or what it may look like. And again, resonating with other people that are going through some of the same struggles. Um, so that did cause for a big jump in mental health disorders during the pandemic. And a lot of the kids use school as a safe space, not having that space to get out of their home where it may have been causing the stress and you have to be there all day. You can't be around other people. You can't socialize. So a lot of social anxieties came out from the pandemic because a lot of the kids didn't know how to socialize after not having to. You were able to text, you were able to use your phone to communicate. You didn't have to interact with people because you weren't expected to during the pandemic. So a lot of kids lost those skills because they didn't use them.
Awesome. Now, it's funny, you talked about like just the influence of the social media and how sometimes that the kids will see others have this, have that, which kind of set a stage like there's something that's missing from I guess that person's life, that viewer life. But that kind of even goes into a deeper issue when we talk about systemic inequalities. And I think when we talk about just our urban settings, and not always have to be about race. It can be about race, gender. How does gender or just access? But how do you see that as far as that contributing towards anxiety or depression in children?
So are you asking like the limited amount of access to resources and education on?
Well, I
So
mean,
I think,
would you see is any like just systemic inequalities? I mean, one of the thing about the whole social media things is it becomes an exposing. It's exposed a lot of things that we didn't see before.
mhm.
You know, I think, I'm a kid that grew up in the 80s and the 90s, well, 80s more so, you know, I compare myself to my neighbor and look, I didn't know I was broken until I moved out. But now well, we have more access to certain things. And not to mention, um, we see more certain things. And I think being able to see how things are not actually equal, how
Mhm.
things that may you never we never thought about how children internalize their view on inequality, systemic inequalities. And do they? Is that something that maybe they don't know how to express, but they are it is contribute to anxiety? Does it contribute to their anxiety or depression? Does it play
That
a
is,
role?
I think that is a very loaded question because I think that it could be bi-directional or, a trickling effect, as you say. I think that systemic racism has always been a thing in America, um, regardless if we want to say it or not. It's always been a thing. There are inequalities that, as minorities in America, we struggle with on a daily basis, and I think that it is somewhat like a learned behavior. So I can say why I say it's like a trickling effect is because we've learned through generations that we can't depend on certain aspects of, the the level of care that we get from mental health professionals, medical professionals, all those places where you think that you are supposed to be able to, and I say supposed to because that is where you're supposed to go to be able to get help. But when you go to those places, sometimes it's not the best. They um it's not always the quality of care that you're expecting as a minority. And I think that that was learned, from our great grandmothers to our grandmothers to our mothers to us. And I think now it's really starting to change a little bit where this generation is kind of turning and learning for themselves. I think the internet is the world. It
Or
opens up a wealth of knowledge for people. But going back to your question, I do think that because there is such a big barrier and a level of mistrust when it comes to the people that we look at as professionals, because you know, up until recently, there weren't a lot of professionals that looked like you and I.
no, not at all.
So that that level of mistrust played a huge role, not only because we weren't being treated fairly, but because they didn't know how to treat us because we present differently.
Indeed. Indeed.
So I think that we learned, and not we, me, and you, like us as a population, we learned that if we want to get things done, we have to do it ourselves. We have to figure it out ourselves. So a lot of the times we don't rely on doctors like when we're sick. We rely on ourselves. We have our own remedies. We have our own ways of doing things because we know that we are going to take care of us the best way that we can be taken care of because we haven't been taken care of by those professionals that we expect to take care of us. And I think that has been passed down to generations now where, you know,
Or I did
oh,
day almost.
right, right.
Yeah.
And it's like, well, you know, I'm feeling sick, so I'm gonna go drink this ginger ale because I think that's gonna help me feel better.
Right.
So it's like almost when you walk into a room full of Black people and it's like an unspoken language when you give each other that look. It's like we already know what that means.
Right.
So it's like it's
Right.
an unspoken thing in our community where we kind of just learn to not depend on anybody because 9 times out of 10 they aren't going to do the job as it needs to be done or how we expect it to be done. And I think that kind of goes into mental health. I think a lot of the times, again, generationally, what happens at home stays at home. You know, we were taught if something is going on mentally, physically at home, you don't share that with anybody else outside of our house. We
I hear
take
you.
care of it at
Right.
home.
Exactly.
Um,
Don't tell family business outside.
right, right.
Right.
And I think that to a certain extent, I believe that to be true. You know, learning and experiencing it. Um, so yeah, I think that that kind of leads to a lot of, you know, if I share this with somebody, are they going to be judging me? How am I going
Right.
to be viewed? You know, it kind of
So it's
all goes back to the inequalities that we just have in our country. Um, you know, there's a
yes.
high level of Black and brown people being misdiagnosed with things. Stress is the leading killer in Black women. You know, it's only 4% of Black people that work in the mental health field. It's it's just a lot of inequalities, a lot of disparities when it comes to mental health in the Black community, the Black
Wow.
and brown community, I should say.
Now, see, that's the thought. So we're not even talking what you took it. These are our stressors. So it's not only the lack of adequate resources that leads to stress, as far as that being in not equal, but it's even the lack of identification. People that actually look like you, look like me, serving in these capacity, whereas that students and their families can
Right,
come to us. Because right, we're professionals, but we're professionals from a community from our communities, and we
right,
do speak the language.
right.
Okay, awesome, awesome. Well, you know what? You also talked about just about some of the mental health concerns with women, and you did a dissertation. So, and I think one thing that stand out about your dissertation, about your research, well, let me see. One thing that stand out about your research is your dissertation on African American women perspective on mental health.
Mm-hmm.
So share with us some of those key findings and how does it relate to the challenges that Black children and adolescents face seeking psychological support.
So I think that kind of just piggybacks off of, you know, a
Yeah,
little bit of my response from the previous question, just
right.
kind of having a generational, I like to call it a generational curse. Um, 9 times out of 10 in Black homes is
Mhm.
mom taking care of the kids, right?
Yes.
And if mom has this perception of mental health that they view it as a negative way or they don't depend on others because they have this what we call superwoman complex. That was what the research found. Then, of course, quite naturally, the kids are going to learn that same behavior and it's going to kind of keep trickling down the line.
Wow.
Um, where, you know, my findings from my research, there were some barriers to it. And one of them was the mistrust. One of them was the the accessibility, whether it be in your community or having access to someone that looks like you that can work with you. Just the misdiagnosis of, you know, Black women, the mortality rate of when you go into a doctor's office of you. I think the biggest thing that came out in my research was for the women, you know, giving birth. Not a lot of Black women come out alive when you are giving birth. And that was a high topic that came up when looking at the mistrust when you go into medical fields and professional places. Um, I do think that just and during my time of my dissertation, I remember this was my favorite question. I don't remember exactly, but it had to do with asking the women that I interviewed about their thoughts on the Black Lives Matter movement and how it affected their mental health. Because a lot of the times as Black women, we do wear a cape. We do stand strong. We do stand 10 toes down, like the kids say. And we don't take that time to really focus in on ourselves and worry about ourselves. We're so busy taking care of everybody else around us. So I like that question personally because at the time of my dissertation, it was the riots for George Floyd and it was a lot of police brutality going on. And as a way of just kind of acknowledging that those things are happening, I wanted to ask, like, what are your thoughts and feelings about that? Because maybe nobody's ever asked you that. And I know it has an impact on you, whether you notice it or not. This is your time to kind of unpack and talk about, not going into a therapy session. I did let everyone know that I interviewed that this was not a therapeutic session, just kind of getting you to unload some of those things that you didn't think were bothering you.
Oh, okay.
So I think a lot of the time it's just acknowledging it and being mindful of it, that education.
Mm.
Another question that comes up to mind about my dissertation is when I ask people about mental health, just mental health in general, the number one things that came up was bipolar disorder, depression.
Mm.
And it's like that's the negative aspect of mental health. That's a mental health concern, not just mental health. Like your mental health is just your mental well-being. Just how are you doing?
Which is
And a lot of the
a
times they did
stigma,
just
right?
name a mental disorder. And it's like,
Yeah.
okay, so you're associating mental health with mental disorder. So you already have this
Right.
negative connotation to
Yeah.
mental health.
Mm. I always say that back in the day, like especially like my family originates from Georgia. And I
Mm-hmm.
was like, if ever I would take my profession down there, the only way I can really make a living if I become a pastor. Like you don't see that, you don't see that some psychology, you go see that pastor. But
Yep. Yep. That
I
was
get
another
that.
thing that came up too, like the
Uh-huh.
Black church. Yep.
Yep. Oh, well, you
Again,
know what?
I think that's just another extended way of saying what happens at home stays at home.
Yeah,
Black church
indeed.
was the home, the
Right.
center.
Uh-huh.
Um,
Well, I mean, that kind of suggests that there's things that needs. I know once I used to be a part of a church, and I remember talking to them, and I was saying, like, if we're dealing with issues that people don't want to go to mental health professionals to deal with, then we really need to start making a ministry regarding mental health a
mhm.
mental health ministry.
Yep.
But that was one
Bridging the
of my
gap.
solutions. But let's just on that same vein, let's talk about solutions. So let's say here you are, Dr. Smalls,
Mhm.
Dr. Kristine Smalls. If you could design the way mental health support works in schools, what what would that look like?
So I've seen it done. So my previous work before coming back into the district here,
Mhm.
um, I was just doing therapy in the school setting. So I worked for a program through Springfield Psychological called the REACH program. And it was me providing therapy to students in the school setting. Um, Now, I would say there are some benefits and, some things that weren't as beneficial,
Well,
with
let me
doing
stop you
it
right
that
there.
way.
So let me stop you. So we're differentiating to what we call school-based counseling to real psychotherapy.
Yeah.
Okay, continue. I'm sorry.
Yep. So I I like the idea because it gives students access to, like, it wasn't an insurance-based program. It was just the school had a grant
Mm.
and we were paid to go to the school and provide therapy to the students that, needed it. And, in our caseload, we can only go up to 10 students, so it wasn't as heavy.
Right.
Um, so that was the benefit of being able to help those students that definitely needed that help.
Mm.
I think the only downfall that I found that some of the traumatic experiences that the students were talking about and then having to go back to math class
Uh,
after.
well, now,
So granted, we gave them that time to debrief if they needed to, but let's say if it was something that was very traumatic and they couldn't get themselves back together to go back to class,
mhm.
it kind of was just like that. Okay, what can we do to kind of transition? Um, gradually we learned our students. So it was two clinicians, myself and another person. We learned our students and, should we get them at the end of the day because we know a lot of this trauma kind of comes up and we don't want to uproot their day if we get them in the morning and they can't get back on track.
All right.
Um,
Well, you speak with that. Now that's interesting because I know there is a push as far as different types of trauma training when it comes to teachers. So I guess so what I'm looking for now when we talk about redesign mental health school, let's think about all the aspects. So whether it's school board policy, teacher training, and um more therapeutic approaches within the school setting outside of the whole school-based counseling. What does how would it really look like when you talk about a whole encompassing system in your eyes?
I think it's a little bit of everything. I can for sure say I personally do not think that there's enough training when it comes to mental health for staff members in the schools. Um, I also don't know if training would do the trick. You know, people have been taught and they're set in their ways.
That's
And if this is a generational thing, then that it is what it is for them. Um, but just I think having access to, if I had to say more training, I think having access to it, just kind of helping them to expand that knowledge and being able to identify certain things. And I think that helps because even if you can't figure out what to do to help, at least someone in the building can.
correct.
Having that person in the building, the resources in the building to be able to give you suggestions or speak to that student individually or help out. Um, so definitely more training can never hurt. Um, I definitely think that policies probably could be changed. I'm not a big policy person, so I don't know the ins and outs of the policies or anything. But I'm sure there's room for growth in the policies where we do, you know,
Well, you know what? A lot of
make
times we're talking about policies in this aspect of it. We always it's kind of attached to money. It's like if you really,
or
like, I think I don't know. I think we were in the meeting, and I said that to one of the I think one of the facilitators was like, if you're really serious about it, put your money where your mouth is.
mhm,
Otherwise, you're not serious about it. And if you're serious about it, put your time where your mouth is. Otherwise, you're not really serious about it. So, and you know what the old saying is, what get assessed gets done. What doesn't get assessed doesn't get done.
right.
So, you know, so it
Yeah,
doesn't.
I think the first step is just more education on mental health and acknowledging the seriousness of it. I think that it's just like any other illness, any physical illness. I think your brain is worth the treatment that it deserves. Because without your brain, you can't do anything. You can't function. It's just like if you needed a new heart, you're going to go take care of that. You're not going to just dismiss it and wait for it to just give out. I think that same treatment should be for your brain, for your mental health, for all of that.
Mhm.
And
Yeah.
I don't think that people think of it that way. I think that they think of it as just, oh, it's just a phase. It's
Right.
something they'll grow out of. It's something that'll pass. But
Right.
it's just as important. You don't say that about your heart. Oh, this, you know, cardiomyopathy is just going to pass.
Mhm.
No, you actually need medication for that. You need to go see your cardiologist for that. The
Oh,
same
no.
thing.
Now you just need some tussin. That's all. A little bit more tussin. Okay. Well,
A
I
big
mean,
vapor rub for your
a
chest.
little vapor rub in that chest. You'll be fine. Shake it off. Shake it off. You know. Well, you know what I gotta say, in New Jersey, they have taken some steps. I think one of the big things is the whole concept of what is that called? I know it's in a couple of our schools here, Camden. I know other districts are using where there is a mental health component that they are introducing. Um, I can't think of the name right now. Kind of it escapes me. Um, but you know what I'm talking about, right? Student support, behavior support, student behavior support.
Is it school-based?
Schools, yeah, school-based support.
School-based youth services?
Right. So I think that's one of the initiatives that came about
Hmm.
from the state, and their ways of addressing the mental health. And I know there's a few other things, other bills that's in play right now as far as just capping certain numbers. But I mean, just asking, so you got to mention, you got to see some of that in practice. Do you think they are enough? Or you think there's something that's missing?
Well, I do know that from my recollection, you can correct me if I'm wrong,
Mhm.
there is not school-based in each building here in the district.
No, it's not. You're right.
So I think that that could be something that could be corrected because it's a lot of work when you're working with kids who have a lot of things that are coming with them. And that usually runs the risk of burnout for
Mm.
staff. And you're being spread thin across all of these school buildings. I think having more staff who are able to proportion their, workload, so they aren't spread thin and they aren't burnt out, so that when things do come up, they're not at their last resort of like just here, whatever,
Right.
trying to just make ends meet. So if I had to say that, I think that is one thing that I would like to see differently or that could change. I think the program is great. I know the one at our building, she does a great job with our students.
Okay. So it's a matter of expansion, though. That's what we're talking about.
Yeah,
We have to expand it. Okay.
right.
So now let's go ahead and give away some free services. So for parents listening, what signs should they look for in their children that might indicate they need psychological support?
Um,
And wait a minute, here's the second part to that. And what steps should they take to ensure their child get the help they need?
so definitely some signs that you can look for. Just changes in behavior. Whether that be not wanting to engage in activities that they really enjoyed at one point in time. Um, just the way they interact with you, the way they are presenting. So if they were this person that was like upkept and cared about their appearance, and now you're noticing that they really don't care about their appearance, whether that be showering on a daily basis, doing their hair on a daily basis, brushing their teeth, all of those things, looking for those different types of changes. Um, Noticing if they don't want to go out as often, like if they were a social person that liked to hang out with their friends and now they're saying they don't want to hang out with friends anymore. Um, just looking for any changes. Even if there aren't changes, some things you can do to help. Just providing that open space for your child to be able to, have conversations with you, make it a safe space, asking about their day and not just waiting for like a good, oh, what made it good? Just having that conversation that you could build upon and just make it comfortable for them to be able to come to you with the good, the bad, and different things. Um, I also suggest if you are noticing changes and steps to take, there are several outlets. One that is very popular, psychologytoday.com. You can filter that website so you can ask for a therapist of female or male. You can ask for black or whatever, race you would like, insurance that you have, the zip code. You can narrow it all the way down and it'll give you therapists that are available based on your filtering.
Can you send me
Um,
that link?
huh?
You said, can you send me that link? What you said?
Yeah.
Okay.
And then Also, I am a big, like within the school setting, I am a big advocate for family therapy. If
Okay.
you don't know how to have those conversations with your kids, going to a therapist is not a negative thing. If you need help in that area, it's like anything. If you want to lose weight, you go to a trainer or you go to the gym, right?
Yeah.
Same thing with building those skills. It's like working your muscle, your brain, learning how to think differently. You go to a therapist to learn the skills of how to incorporate these things into your home. And that's
Yeah.
kind of my food for thought. You know?
That's awesome thought. Okay, well, I'm not done. So now we got educators because they play a big role in the child's life. Yeah. So what can teachers and school teachers and school staff do to support students' mental health, especially in schools where resources are stretched thin?
So they can kind of do the same thing. I know I've seen in classrooms where they have in the morning where you do like a quick check-in and journaling, mindfulness, any of those type of things that kind of gives the students that safe space. I think that's the important thing here, is just providing a safe space to be able to be comfortable enough to just be. Because sometimes that is something that the students can't do because they have a lot of responsibilities outside of school or stressors outside of school. So just giving them that space to see. And I'm a big, if you want to know something, research it.
Oh,
Google, you learn how to incorporate these things into your classroom. The only way you are going to learn is if you do the work. It's not going to come easy. You have to build these relationships with these kids. They're not just going to give it to you. You have to actually do that work. And sometimes it doesn't even take a lot. All you have to do is compliment a kid once, and you have you have a relationship built right there.
you're right about that.
Um, just learning your students and getting to know them outside of school, because I think a lot of the time teachers kind of do focus on the things that they have to, for whatever reasons, evaluations from the administrative staff. But just kind of learning who your kids are and
Yeah.
learning where they're coming from and listening to them. I think the biggest thing is just kind of not listening to respond, but listening just to listen. Because sometimes it's not a response. They don't need your pity. They just need somebody that is going to hear them and look at them and value their perspectives and their input on things.
Okay.
And
Um,
sometimes they're going to teach you how they want to be treated, and it kind of goes from there.
awesome. Well, okay. Well, finally, for the student listening, maybe a middle schooler or a high schooler struggling with anxiety or depression, what's one thing you want them to know?
Um, I had to say one thing there. There's always help out there. You can go to any person on your child study team at school. They should have resources there for you. You can talk to any staff member at school that you feel comfortable with, um, and they can find the resources for you, or find someone that can help you even if they don't know how to. And I think the biggest thing is you're not alone. I know sometimes it feels like you're the only one that's going through what you're going through, but a lot of the time there's a lot of other students that are going through some of the same things.
But Dr. Smalls, this has been a powerful conversation. Thank you for your expertise, your passion, and for the work you do every day to improve the life of young people. Give us some closing remarks.
Well, so I definitely appreciate this conversation. I like to have these conversations. In fact, this is maybe my first interview since I've graduated where I have been able to have like these type of conversations. Um, and I think that being back in Camden City School District, who has a place near and dear in my heart because, I am from Camden and I have once been one of these students, and I always lived by the motto of being the person that I needed when I was growing up. And I think that as long as I keep that in the forefront of my mind, it's never worked for me here when working with a student.
Fantastic. Thank you. Well, before we wrap up, I want to leave our listeners with a challenge. If you're a parent, check in with your child today. If you're an educator, take a moment to connect with a student who may be struggling. And if you're a policymaker, ask yourself, what are we doing to ensure every child has access to the mental health support they need? We need action, we need reform, and we need it now. This has been Breaking Mental Matrices. If you find today's episode thought-provoking, share it with a friend, a teacher, a policymaker. Let's keep this conversation going. Until next time, stay informed, stay engaged, and never stop questioning the status quo.
Yeah.
There you go.